The health disparities found in access to mental health care are most compatible with the internal colonialism theory. This is a form of structural inequality. While there are many racial roots to this health disparity in today's society, this specific inequality is most dependent on the socioeconomic status of the individuals. We see this inequality prevalent not only in predominantly Black urban areas but also in rural white areas. It is common that in areas suffering from poverty, you not only see a lack of mental health access but also lack of access to many other forms of healthcare. The lack of healthcare access is directly related to the fact that most of these individuals do not have health insurance, which is a common attribute of individuals of lower socioeconomic status. In 2014, 32 million adult Americans were uninsured, 90% of which were considered a low-income family. Approximately 56.5% of adults with a record of mental health illness received no treatment in the same year. It is the state and local level policies that have the biggest impact on the access to mental health care. These inequalities are structural failures by governing powers to provide a necessity to their populace. This lack of care is seen with a cold indifference, and mental health is seen as an amenity to individuals of higher socioeconomic status, a luxury. Individuals of higher socioeconomic status have better health insurance, reliable means of transportation, and most importantly, actual mental health facilities that are near them. These groups of people are consistently at a disadvantage based on the social structure. As previously stated, these individuals are not only minorities who live in the city, but also Caucasians who live in rural areas. They tend to have jobs with minimum or no benefits, low pay, and have lower academic achievement, nor the ability to travel to a facility.
Today, we have today in our society a great injustice. Millions of Americans lack access to the mental health care they need. This injustice has its root in racist policy and is maintained by a mechanism of income and wealth inequality, and we see this particularly predominant in Black urban areas. The works of Du Bois documented the gross disparities in healthcare along race lines in the 1800s, looking back at the poor living conditions created in the wake of slavery. These works can surmise the race lines that these inequalities have been built upon. However, Du Bois even then attributed at least some of these disparities to income, saying that to be a poor man is hard, but to be a poor race in the land of dollars is the very bottom of hardship, acknowledging that at his time at least, being Black was the main cause of these of this income disparity, or it at least keeps you, or at least has a role in Black life. While Du Bois didn't so much touch on the access to mental health care, we have to remember that this was not a commonly talked about subject for the time, and that while I wouldn't say Du Bois did not speak.
While it is true that this inequality is very prevalent in urban minority areas, it is also very prevalent in rural white areas of the United States. We found that in 2012, almost 19% of the residents of these areas that were deemed rural in the United States had been diagnosed with a mental health illness, and that many more had gone undiagnosed, leading to upwards of 10 to 11 million people in the United States. There were three main challenges facing these rural residents for mental health care access. These rural residents often had to travel long distances to receive mental health services. They were less likely to be insured for the mental health services, and they were less likely to recognize these mental health illnesses on their own. And all of these reasons can basically be attributed to some parts of internal colonialism theory that relates to the individual's SES, as well as the economic underdevelopment of the areas that they're living in.
In terms of discussing um, the access to mental health facilities in poor communities, it's almost impossible to discuss that issue without talking about um, access to mental health facilities um, in affluent communities, um, this matter is a bit sort of kind of easy to approach. Affluent people have a lot of money. They can afford just about anything in terms of mental health care. Um, they have the best quality simply because they have money. They're rich. Again, they can afford just about anything. Um, Northwestern Washington, D.C. is our picked area to talk about. Um, you have so many hospitals, practices all over the place, privately owned practices. Compared to other parts of Washington, D.C., such facilities is almost non existent. Um, it was a bit hard. It was a bit hard finding literature on this matter. Um, to me, it seems like this is really this is this is what really the problem is, because these people don't see disparities in access to mental health. Um, yes.
In conclusion, disparities in access to mental health facilities by theory are structurally formed. Governmental officials failed at implementing the prescribed social policies designated to adequately service communities. Disparities in access to mental health facilities or any other health related issue is a major problem that must be corrected.